Hey, it's Mr. Shrum, and we are about to finish our lesson about nerves and the nervous system and the peripheral nervous system. And today we're going to talk about nerve issues. So, what can go wrong in the realm of nerves? Problems to the peripheral nervous system can range from mild, so not too bad, to severe, which is quite painful and risky. Some of these problems include paresthesia, carpal tunnel syndrome, Bell's palsy, and peripheral neuropathy. So let's take a look at each of these. All right, so picture yourself. Have you ever felt pins and needles in your arms, legs, or feet? Have you ever felt that sensation moving up and down your body? Most likely you have. After you sat with your legs crossed for too long, that's when you would have felt that. Or if you fell asleep with your arm stuck under your head and then your hand gets a little numb. So that prickling sensation is known as paresthesia. And that occurs when pressure is sustained on a nerve for too long. It's normally a mild temporary problem, and you can resolve it by removing the pressure placed on that nerve. So if you move your hand, you move it around for a bit, you should be back to normal relatively soon. Another common problem with the peripheral nervous system is carpal tunnel syndrome. That begins as a mild, achy wrist, but then progresses to a severely painful disorder. And it's caused when the median nerve is compressed. And that median nerve is an important nerve of the brachial plexus, the brachial network of nerves that we talked about last time. And that plexus runs along the forearm to the palm of the hand. Or I'm sorry, the median nerve is an important nerve that runs along the forearm to the palm of the hand. And it innervates or stimulates the muscles that allow your fingers to move. At the wrist, it passes through the carpal tunnel. The carpal tunnel is a passageway of tendons and ligaments. Irritated tendons and swelling restrict the room within the carpal tunnel, therefore compressing the median nerve and causing carpal tunnel syndrome. This usually happens to adults. Women are more likely than men to get carpal tunnel syndrome. And there's not a single cause for carpal tunnel syndrome, but rather a combination of risk factors, such as an anatomically smaller carpal tunnel. So you just may have a smaller carpal tunnel naturally. Nerve damaging diseases such as diabetes and alcoholism, inflammatory conditions such as rheumatoid arthritis, conditions that change fluid balance within the body, such as pregnancy, thyroid disorders, and obesity. Working with vibrating tools or on an assembly line. These are all risk factors. And how do you treat this carpal tunnel syndrome? If it's a mild case, the individual is able to treat the problem with medication, exercise, and alternative therapy such as yoga, where you're trying to stretch certain areas of your body. In severe cases, carpal tunnel syndrome, an individual may need to undergo surgery. And they have a little information in the field trip section of this lesson if you want to go check that out. but we'll move on to Bell's palsy. Now, Bell's palsy is a disorder caused by swelling or irritation of the seventh cranial nerve, and that is known as the facial nerve, if you remember from last time. It causes the following symptoms: paralysis of usually one side of the face. Paralysis means that the individual can't move or feel the face on one side. Um, that is similar to a stroke, where you see a person's face droop halfway. Similar look. Twitching, weakness, drooping eyelid or corner of mouth, drooling, impaired ability to taste. Now, it is unknown what causes the facial nerve to become irritated or swollen. Doctors think an immune or viral disease may cause it. Bell's palsy comes on suddenly and is at its worst 48 hours after symptoms are felt. So it comes quickly and worst 48 or 2 days after symptoms are felt. And there's the facial nerve, number 7 right there. Treatment. So most cases of Bell's palsy improves without treatment. Recovery begins within 2 weeks of the first symptoms and then is complete between 3 to 6 months later. You may learn more about Bell's palsy in that field trip section of this lesson. Peripheral neuropathy. That is one issue in which one or more nerves of the peripheral nervous system, the PNS, are damaged. The damaged cranial or spinal nerve that leads to the following symptoms: numbness, tingling, or weakness, paralysis of the muscle the nerve innervates, burning pain, organ or gland dysfunction. Now, this peripheral neuropathy may be inherited or acquired. Inherited peripheral neuropathy is when the individual is born with a genetic mutation or a mistake in their genetic code. Acquired peripheral neuropathy occurs due to physical trauma to your nerves, toxins, tumors, cancerous tumors, alcoholism, or metabolic disorders like diabetes. Inherited means you get it when you're born due to some type of genetic mutation or something involving your genes. And then acquired is things happen after you are born. Could get into a wreck, develop cancer, and so on and so on. And the treatment for peripheral neuropathy, there are no treatments for inherited peripheral neuropathy. If you're born with this, there are no known treatments to treat it. No treatments to give to the individual. Someone experiencing acquired peripheral neuropathy can lessen the effects of the disorder by healthy lifestyle habits like exercising, eating a healthy diet, avoiding toxins, maintaining an optimal weight, limiting alcohol consumption. And you can learn more about this neuropathy along with Bell's palsy, carpal tunnel syndrome, and the tingling numbness sensation that we talked about earlier. This one, no, this paresthesia. So problems to the peripheral, the PNS, can range from mild to severe. And some of the problems we talked about, the paresthesia, the tingling sensation when you've been compressing a nerve for too long, carpal tunnel syndrome, dealing with your brachial plexus in your wrists, Bell's palsy. That is slight paralysis of the face and your facial nerve, uh, and other symptoms as well. And peripheral neuropathy, where some of your nerves are damaged. And that's the end of that nerve issue section. So if you're interested in any of these, I would go to the field trip section under the tabs in this lesson, and then check out some of these treatments or issues so you can learn more about them in a different way besides me just talking to you in a lecture. But yeah, that's it for today. And I will see you all next time. Bye-bye.